Hi everyone, thanks for watching Health Matters. I'm Kelsey Meehan with Alberta Health Services, and I'm here today talking with Dan Kammer, the Executive Director of the Medicine Hat and District Health Foundation. And we're just going to be talking a little bit about how you and how the community can get involved in helping out with local healthcare. So how's it going, Dan?
Excellent, Kelsey. Good morning.
Good. So we're well into the new year now, and people might be starting to think about some ways that they can kind of get involved in their community and give back to their community. So specifically with healthcare, how can local donors get involved in giving to their local healthcare?
It's a great question. Donors can make an impact every day locally. There are services, equipment, and other programming needs right here at the Medicine Hat Regional Hospital that we can impact service every day. It's often said that that government funding should take care of many of these things, and we agree, to be frank. But at the end of the day, the reality is that it doesn't. And so, if we want to have enhanced services or services we might not be able to have here locally or here yet, it's important for the community, or that's the opportunity for the community to then have the impact locally by making donations directly to the Health Foundation.
Okay, and so how does one go about giving then to the Health Foundation directly? Do they go online? Do they come and see you in person, or how does that work?
All of the above. We have an office right here in the hospital. They can come, they can call us, they can visit us at inyourcommunity.ca, and there's a number of options within any of those avenues. So we can direct donations to a specific department, to a specific area of healthcare, or even to a specific piece of equipment. And so we're happy to do that and work through those choices with the donors so that they can have the impact in the area that they want. Maybe an area of special, where there's a special attachment, where they've had a friend or a family member use that service and they'd like to make it better, they can do that here.
So what are some of the reasons that you notice why people do get involved with health foundations and do get involved in giving back to their communities?
What donors tell us is the main reasons is they feel a connection to a specific area within healthcare. Oftentimes that's because of a visit to a hospital or to the health system that's not always that much fun. But the result is that they truly just want to make a difference. Health foundations, the role of health foundations is really then to connect those donor passions or those philanthropic wishes to identified healthcare needs that every hospital and every health center in Alberta has, to put together those donors and those needs to make healthier communities for everyone. Donors really feel the connection when they can see that their dollars make an actual difference. And we do our best to not only provide them with the opportunities that might be available for them to make an impact, but also then to report back to them on the results of their donations and show how those donations affect real people and real lives in their communities. And once you can do that and connect, make a full circle, then we've made a friend or a supporter for a very long period of time. And that's actually a really, really rewarding, a really fulfilling part of our jobs within health foundations is to see that difference being made every day.
Right. And so if somebody does donate to a health foundation, then how does that work in terms of them finding out when their money is used and where it goes? How do you report back to them, as you mentioned?
There are a number of different ways. I think through annual reports, through websites, through other marketing materials. We have newsletters, mail campaigns, and so we try to report on a regular basis. As well, in addition, I think most donors expect customized stewardship or reporting. Depending on the size, of course, and the complexity of the donation or the size of the equipment purchased, they'd like to see personally, and that often includes letters directly outlining what's happened. It oftentimes includes tours or visits to the hospital or health center showing them actually the equipment or the space in use where actual people are using it. And so there's a variety of different ways that we try to then further connect them to the difference that they've made. And when we can or where we can do that. We can't always do that. Obviously there's some things that we purchase that we just can't see in daily use, but there are lots of things that we can. And we're trying to do more and more of that every day. Telling stories is oftentimes the best way, and if we can have that story told by the actual patient or the family of the patient or the healthcare provider, it works the best and makes the most difference.
All right, that sounds great. Thanks for joining me today, Dan.
Thanks, Kelsey.
And thanks for tuning into Health Matters, everyone. If you want to get in touch with your local health foundation, you can visit our external website for Alberta Health Services at www.albertahealthservices.ca and search Health Foundations.